We were also surprised yesterday, and our County Minister of Health, the Presa this morning, and he spoke to that issue about our healthcare workers. Let me say that somebody may have misled them in talking about the issues they're talking about, because I can confirm, and this is what is really the truth, that we've done promotions effective 1st of July. All the healthcare workers, we had a meeting with them sometimes last year. We advertised for promotions, and out of the people who were interviewed, 521 have been promoted, and they got their letters. We're effecting their promotions this month, 1st of July. So that issue of promotion has been addressed. 2, I saw them talking about the issue of delayed salaries. I can confirm our county government to Meru has paid all workers, not only the healthcare workers. They have been paid their salaries to date. They started receiving salaries yesterday, and today everyone has been paid. So we are also a bit surprised why they said that they have not been paid, but salaries are paid up to date. And even when we get delays of getting our disbursement from Exchequer, from the National Treasury, we have always gone to the bank to actually, speak to them so that they allow us to pay salaries using overdrafts. So we have paid salaries up to date. I also saw them talk about the NHIF. We have made deductions to NHIF. We have rebated deductions to NHIF up to date. We have not submitted or that remitted for deductions for the month of June, and that will be done on 9th, because the due date for submitting deductions for NHIF is 9th of the following month. And today is only 2nd. So we will engage the union officials who are talking about that. We have not seen any communication from them, so we don't know why they are complaining, but we will engage them. As you all know, our governor believes in teamwork. He believes in engaging our staff, and we'll engage them and find out why is the problem. But as far as we are concerned, we have no issue with healthcare workers.
That when it comes to healthcare workers and the people who work in our hospitals, it is really a calling. It's a calling. They do such important work, with such a passion and intensity. There can be no jobs that are more personal than the issue of healthcare workers, the doctors, the nurses, the lab people. It cannot get more personal than that, and it cannot get more important than that. And that is why I keep on appealing to our unions and our workers. When there is a problem, let us engage dialogue. Not every issue is an issue of downing tools. If you talk about downing tools in January, downing tools in February, by the time you get to December, everybody is expecting you to down tools. So I really appeal to my brothers and sisters, please, not every issue must be a threat, for downing tools. Sometimes let's engage. Let's say we have started a dialogue. It's a way of resolving problems, because you cannot accuse a county or national government of having a hard line when you start from a hard line position yourselves. And since we are all brothers and sisters, since we are all, the intention by the end of the day is to cure patients. The intention by the end of the day is to put a smile on a patient's face. If that is the intention, if this is why we are here, if this is why we got employed, if this is why we work, then it follows without saying that long before we leave a patient, we have exhausted everything else. It cannot be that day one, I'm bad on patient. Please, tafadhalini, nawasihi. Because even as we deal with all these other issues, even as we talk about dialysis, the ICUs, COVID is still here. Today, some 523 people have got positive. 523 people, that's a lot of people. We lost 11 patients because of the same thing, because of COVID-19. And therefore, these statistics will be given to the media hereafter, our positivity rate remains above the World Health Organization recommended 5% at about 8.1% when we tested 6,469 people. So even as we deal with these other matters, let's never forget that the COVID pandemic is here with us. And as we observe a new variant that is now coming at us, this Delta variant, it is important for us to know it might come with new things that we have not anticipated. For example, in the United Kingdom, they are talking about patients who have been vaccinated with 2 vaccines, 2 doses already, and those patients are contacting the disease. You know, we also know of 1 or 2 cases in Kenya who have taken 2 doses and have still, you know, contacted the virus. So what we are saying is that this is a revolving issue. It's an emerging issue every day. And therefore, our healthcare workers, as our frontline soldiers in this fight, please stay on course and let's work out anything that comes out of the ordinary through dialogue.